Men, I want you to picture waking up tomorrow with a firmness you haven't experienced in years. No pills, no devices, no risky interventions. Just a few minutes of simple, precise self-stimulation to awaken your body's inherent erection process. I'm Dr. Juliana, a specialist in men's health with over a decade of helping men regain their intimate vigor. And today, I'm going to demonstrate 3 specific zones on and around your member that can help bring back morning erections by boosting blood flow, relaxing key muscles, and increasing nerve sensitivity. If you've been missing that natural morning rigidity, stick with me because by the end of this presentation, you'll know precisely where these spots are, how to stimulate them correctly, and how often to do it for genuine results. Before we get into the specifics, you need to grasp the why behind this method. Once you understand the underlying science, you'll realize you're not just touching your skin, you're accessing one of the most powerful systems in the male anatomy. Erections are not random or mechanical. They are the result of a meticulously coordinated process involving your brain, spinal cord, blood vessels, nerves, and muscles. It all begins with nerve impulses, tiny electrical signals that travel at incredible speed from your brain or sensory nerves to the erectile tissue. These signals instruct the smooth muscles inside the penis to relax, which allows blood to flow in and fill the spongy chambers known as the corpora cavernosa. As they fill up, veins that normally drain blood away get compressed, trapping the blood inside and creating firmness. Here's how age alters this dynamic. Over time, blood vessels in the pelvic area can become less flexible due to reduced elasticity in the arterial walls, a process sped up by years of minor inflammation, wear and tear, or conditions like high blood pressure. Concurrently, nerve signals can slow down, meaning the electrical messages from your brain or sensory receptors don't travel as quickly or as strongly. This double challenge, sluggish circulation and diminished nerve signals, is a primary reason why morning erections often start to diminish after 50 or 60. Targeted pressure point work is effective because it sends an immediate wake-up call through your nervous system. When you press or massage specific points, you activate clusters of sensory nerve endings that connect directly to the reflex pathways responsible for erection control. These signals don't just stay local. They travel to the pelvic nerve plexus and even up to the spinal cord sacral region, which houses the erection center. This sets off a chain reaction. The nervous system tells the smooth muscle in the penis to relax, the arteries to expand, and blood to flow more freely. But it doesn't stop there. Some of these points also have a direct influence on the pelvic floor muscles, the muscles that provide support to the penis during an erection and help control ejaculation. Activating them can improve their tone and responsiveness, making it easier to hold on to firmness once you have it. This is why the effect of this work is often two-pronged. It can help initiate erections more easily and also help you maintain them for longer. When you apply pressure or massage to the right spots, you are essentially bypassing some of the age-related slowdowns and giving your system a direct, hands-on boost. Think of it like rebooting a computer, clearing the lag, refreshing the signal, and letting the components work together smoothly again. Performed regularly, this type of stimulation can retrain your erectile reflexes, improve vascular flexibility, and even heighten nerve sensitivity over time. The first spot we'll focus on is the base point, located right at the beginning of your member, precisely where the shaft meets the pubic region. To locate it, trace your fingers along the underside of the shaft toward your body. You'll feel a slight indentation or groove, almost like a natural joint where the erectile tissue merges with the deeper structures anchored in the pelvis. This area may feel slightly different from the rest of the shaft, a bit firmer or more textured, because it's a junction point for important anatomical structures. Why is this spot so crucial? Right below your skin here is a dense web of sensory nerve endings, including parts of the dorsal nerve of the penis, along with key blood vessel connections that feed directly into the erectile chambers. Consider it a central hub where signals from your nervous system and circulation meet. By stimulating this area, you're essentially activating both your nerve pathways and your vascular system simultaneously, promoting better communication between your brain, spinal cord, and your member. When you apply gentle but purposeful circular motions to the base point, you're sending 2 important messages to your body. First, you're telling your blood vessels to open up and let more flow through, which enhances circulation. Second, you're telling your nerve fibers to wake up and prepare to transmit signals more efficiently. This combination prepares the erectile tissue to respond more quickly when signals of arousal arrive, whether that's in the morning or later in the day. Here's how to do it correctly. Position your thumb right over the base point while your fingers support the back of the shaft. Start with moderate pressure, enough to feel the tissue beneath your thumb, but never to the point of discomfort. Make small, slow circles, letting the warmth of your touch gently spread through the area. As you continue, you can gradually increase the firmness of your pressure, especially if you feel the tissue starting to relax. You might notice a pleasant warmth, a subtle tingling, or a sense of fullness beginning to develop. These sensations are your body's way of telling you that blood flow is improving and your erectile tissue is becoming more responsive. If you don't feel much at first, don't worry. Consistency is key. Over time, daily practice will heighten sensitivity in this area and make the results more evident. For optimal results, work on the base point daily in the morning, ideally before you even get out of bed when your body is naturally relaxed. A warm shower is another perfect time, as the heat will have already softened your tissues and improved blood flow. Over several weeks, this simple but precise technique can retrain your erectile reflexes, helping to restore those strong, reliable morning erections you thought were gone. The second point we're focusing on isn't on the shaft itself but in a slightly hidden, often overlooked area, the perineum. This is that soft, slightly springy patch of tissue situated between the scrotum and the anus. Many men ignore it entirely, but in terms of erection strength and control, it is an absolute powerhouse. Why? Because it sits directly above the bulbospongiosus muscle, a key player in maintaining firmness once you're aroused. The bulbospongiosus muscle is one of the main muscles in your pelvic floor, responsible for trapping blood inside the penis during an erection. Think of it as a natural clamp that keeps blood from escaping too quickly. Over time, especially with age, this muscle can weaken if it's not actively engaged, making it harder to sustain strong erections. By applying targeted pressure and massage to the perineal spot, you can reflexively activate this muscle, essentially giving it a workout without even doing a full set of Kegels. To find it, either sit in a comfortable chair or lie back with your knees slightly apart. Using 2 fingers, usually your index and middle fingers work best, press gently but firmly into the center of the perineum. You are not pushing hard enough to cause pain, but enough to feel the underlying muscle respond. Move your fingers in slow, deliberate circles, staying centered in that sweet spot. As you massage, you may notice subtle sensations building, perhaps a gentle warmth radiating toward your penis, or a faint pulsing as blood flow improves. That's your pelvic muscles waking up and your circulation responding. Spend 2 to 3 minutes here, keeping your touch steady and controlled. For an added boost, combine this with light pelvic floor exercises like Kegels, either before or after the massage. This combination doesn't just help in the moment, it trains the muscle to contract more powerfully during arousal, making your erections feel fuller and more dependable over time. The perineum may be out of sight, but when it comes to restoring morning vitality, it should never be out of mind. The third and final spot is at one of the most sensitive regions of the male anatomy, right beneath the head of the penis. This is known as the glans, and more specifically, we are targeting the ring-like ridge where the glans meets the shaft, called the corona. This area is packed with an incredibly dense concentration of sensory nerve endings. These nerves are your body's main messengers for sending arousal signals to the spinal cord's erection center. When this spot is stimulated with the right balance of pressure and rhythm, it can heighten nerve responsiveness, making it easier to transition from arousal to a full erection. It's almost like tuning up your body's arousal circuitry, so it responds more efficiently when the time comes. This spot works best when the stimulation is controlled. Too much intensity here can overwhelm the nerves and have the opposite effect. To work this area, gently grasp your member with your thumb and forefinger, positioning them on either side of the corona. Lightly pinch the ridge and hold for about 5 seconds, then slowly release. Repeat this hold and release action for roughly 1 minute, making sure to keep the pressure firm but comfortable. After that, switch to slow circular motions around the entire circumference of the corona, letting your fingers glide just enough to stimulate the nerve endings without causing friction or irritation. This second minute of circular work helps to awaken the sensory pathways even more, encouraging faster signal transmission between the penis and the brain. Over time, consistent stimulation of the corona in this moderate, rhythmic way can lead to stronger, more frequent morning erections. You may also notice an improvement in overall sensitivity during intimacy, making arousal feel more natural and spontaneous. Remember, this isn't about overwhelming the nerves. It's about gently reconditioning them to respond the way they did in your younger years. Think of it as a daily reminder to your body of how good blood flow and nerve coordination are supposed to feel. The very best results happen when you treat these 3 spots not as isolated tricks, but as parts of a single, intentional regimen. Here's the sequence I recommend to my patients for maximum benefit. Begin with the base point for about 90 seconds, making those small, steady circular motions until you feel the area become warm and responsive. Then, shift to the perineal spot for 2 minutes, pressing and massaging in slow, deliberate circles to activate the pelvic floor and promote deeper circulation. Finally, finish with the corona for another 2 minutes, using that hold and release technique followed by gentle circular strokes to reawaken nerve sensitivity. Done back to back, this sequence stimulates blood flow, engages muscle support, and sharpens nerve communication. All the key elements needed for firmer, more reliable morning erections. Now, I want to set the right expectation. This is not a magic button that transforms things overnight. Your body needs time to adapt, to retrain those blood vessels, muscles, and nerves to work together again. However, many of my patients start noticing subtle but encouraging changes within just 2 to 4 weeks. Improved warmth and fullness in the mornings, erections that last a little longer, and a general feeling of increased vitality in the pelvic area. For truly lasting improvements, combine this daily pressure point routine with healthy lifestyle habits. Staying well hydrated throughout the day keeps your blood volume and circulation at their best. Keeping your pelvic floor strong with exercises like Kegels adds to the firmness you'll notice from this technique. And don't underestimate the power of nutrition. When you make these steps part of your daily rhythm, the benefits tend to multiply. The points become more responsive, circulation improves, and your body begins to remember how to perform the way it once did. It's about creating an environment where strong, natural erections can happen more easily, and doing it in a way that's safe, drug-free, and completely within your control. Gentlemen, you don't have to accept weaker or disappearing morning erections as a normal part of getting older. Your body still has the ability to respond. It just needs the right stimulation and support. By pressing these 3 points daily, you can retrain your nerves, restore circulation, and bring back that morning confidence without drugs or risky procedures. If you found this information helpful, please like this video, share it with someone who needs it, and subscribe to my channel for more expert advice on men's health. Your intimate health is a reflection of your overall well-being. So every step you take toward better circulation and muscle tone will pay off in the bedroom and beyond.